Hello, this is my presentation on the joint evaluation of the United Nations Population Fund, UNFPA, and the United Nations Children's Fund, UNICEF, global program to accelerate action to end child marriage. To start with some background on the topic, UNFPA and UNICEF define child marriage as a marriage in which one or both spouses are under the age of 18. This program, known as GPECM, was founded on the belief that child marriage impedes on children's rights and welfare by depriving, mainly girls but sometimes boys as well, of their education and future economic opportunities. Child marriage has also been found to increase risk of domestic and sexual violence, as well as the risk of maternal or newborn mortality. This issue has been becoming a more prevalent one as it is included in the Sustainable Development Goals. Managed by UNFPA and UNICEF, GPECM is currently implemented in 12 countries and 4 regions. It takes a diagonal approach that varies by country or culture. Here is the strategic objective of the program. It reads, "The strategic objective of the GPECM is to accelerate action to address child marriage by enhancing investments in and support for unmarried and married girls, and by making visible the corresponding benefits, by engaging key actors including young people as agents of change in catalyzing shifts towards positive gender norms, by increasing political support, resources, positive policies and frameworks, and by improving the data and evidence base." The purpose of this evaluation was to evaluate the effectiveness of this strategic objective. This evaluation was conducted externally by 3 consultants, and there was involvement from the boards of both organizations in the organization of this evaluation as well as throughout the process. This evaluation was to examine Phase 1 of 3, which ran from 2016 all the way through 2019. Evaluators utilized complementary forms of data collection. These included desk reviews of documents, questionnaires for desk review offices, key informant interviews with stakeholders, focus group discussions with stakeholders and beneficiaries, and direct observation during field visits. Qualitative methods were mainly used, but coming from this evaluation, recommendations were made to utilize more quantitative methods of data collection in the future. Now I wanted to discuss some of the evaluation tools that were used. On the right is a small section of the Key Informant Interview Guide. The interviews were long, in-depth, and featured a lot of "to what extent" type questions to best quantify responses. For comparison, focus groups were held with direct beneficiaries, who are those who participated in the program directly, as well as indirect beneficiaries, such as family members or community members who know individuals who have participated in the program. Questions for these were phrased as, "What changes have you seen?" And for country visits, not all countries who participate were visited due to time and cost, so countries for visits were determined after evaluating the prevalence of child marriage in that country, the scale of the program, and the country's place on the Human Development Index. After the evaluation, it was determined that GPECM was on track to achieve goals. Effectiveness was measured in terms of the following 5 outcomes. First was reach. GPECM is far exceeding expectations for reach. Their goal was to reach 2.5 million girls by the end of Phase 1, which ended in 2019, but actually they were able to reach 5.5 million girls by mid-2018. Reach was so successful thanks to strong partnerships with national governments. Outcome 2 measured how effectively UNICEF and UNFPA were working with countries to establish programs, and it was deemed that they were working closely and effectively. Outcome 3 observed that thanks to this program, other outcomes were able to improve as well. After the start of this program, notable improvements in the number of schools as well as the quality of education that was available were made. This was an indirect result of GPECM, but an important one nonetheless. Outcome 4 looked at the collaboration and determined that there was a high level of collaboration between UNFPA, UNICEF, and national and state governments. It was also recommended that advocacy becomes more prevalent in the future to increase funding. And Outcome 5 determined that although it is a positive thing that the program is scaling up, it is at risk for doing so without significant proof of evidence to show that it is an effective program. And I will explain that more in detail in a moment. Evaluators first summarized their insights thematically. It was determined that the program is relevant, welcomed by stakeholders, and responding to growth well. The program is gender responsive, but it could benefit from increased involvement of adolescent boys to more effectively combat patriarchal norms. The program should increase accessibility and ensure effectiveness to remote areas. This is where the interventions are needed the most. These are the girls most at risk to face the negative effects of child marriage, so more attention needs to be paid in these areas. The program should continue monitoring and evaluating, especially as it continues to scale up. It was found that the program has established a significant reach and led to progress in areas beyond its initial goals, such as with health and education. As for normative support, UNFPA and UNICEF are working at the highest level of collaboration with governments. More evidence must be collected while scaling up. This can be done by increasing data tracking efforts and establishing an evidence base to compare progress to. And they found that the joint programming is effective, but improvements can be made at state and local levels. So while UN organizations are working well with national governments, they need to improve their relationships with smaller governments in order to increase the effectiveness of this program. From this, evaluators then produced 8 main recommendations for improvement of GPECM. First, it was suggested that normative leadership is prioritized. This can be done by leveraging UNFPA and UNICEF to better support governments' involvement in the program, as well as establishing evaluations for government involvement through how they utilize funding of affiliated programs, such as those that involve health, justice, education, social protections, and vulnerable girls. Next, it was recommended that the framework for country contextualization is expanded. This means deepening the understanding of child marriage in different areas. For example, is a girl being married based on religious beliefs? Is it for economic purposes? Or what other social determinants lead to this practice? The third recommendation was about the databases. We know that UN organizations have a lot of connections, so they should be better utilized to gather evidence. Evaluators recommended that partners and key stakeholders become more involved and more connections to other groups working on similar topics are made to deepen the evidence base. These connections can be made internationally, at country level, or even local organizations can offer what evidence they have gathered on these topics. It was also recommended that the commonly used terms jointness, convergence, and complementarity are more clearly defined. The fifth recommendation was again related to strengthening and monitoring reporting systems. This would help create that evidence base that has been discussed, as well as creating information that can be used to compare to better measure changes in knowledge, attitudes, practices, and norms. It was recommended that UNFPA and UNICEF work to create guidelines on optimum areas for investment, as well as to better document unintended consequences, both positive and negative, then citing the improvement in numbers and quality of schools. And to do so, more human resources are needed, which brings us to the sixth recommendation. More people are needed to manage processes and to ensure the quality of programming remains high. It was also recommended to strengthen the program overall. This can be done by involving boys and fostering positive masculinity, intensifying efforts to reach vulnerable girls in remote locations, and to better demonstrate the sustainability that comes with the decision to delay marriage, such as the economic improvements that have been seen for girls. And lastly, if the program wants to keep expanding at the rate at which it is, more money is needed to do so. Shortly after that evaluation was published, UNICEF responded with a fully fledged action plan. This demonstrated their transparency and dedication to this cause. All recommendations were agreed with or partially agreed with. They have actions planned, they have responsible offices and persons appointed, have expected completion dates, and some are already being implemented. The bottom of this slide shows a screenshot of just one recommendation, number 5, which was to better monitor and track progress. As you can see, the recommendations were broken down even more and have clear actions to attempt to resolve and improve for the future. If we look at the example on the bottom, 5.4.1, which is to document unintended consequences, you can see that UNICEF and UNFPA are the responsible office. There's the person in charge. The expected completion date is December 2020. This project is already underway, and they are doing so by using guidance developed by UN Women, further strengthening their partnerships with other UN organizations. Overall, GPECM seems to be an extremely effective program. They are on track to achieve all goals and objectives, even exceeding expectations in multiple areas. There was not much outside discussion on this program, other than from associated organizations or from the UN itself, all of which seem to have positive reviews about this operation. Moving forward, to continue to operate as a highly effective program, UNFPA and UNICEF will have to better utilize their leverage to foster greater national involvement, expand and specify programming, and establish a greater evidence base. Based on this evaluation and the subsequent management plan, UNFPA and UNICEF have proven themselves as involved and transparent organizations with a strong commitment to end child marriage and improve the lives of impacted girls. Thank you.